They either have some amazing shows or publications. But Mike, the one thing that I really want is I want us to help you because you've been so good to me and good to all of us. God bless you, my friend. I want us to make sure we promote your book well. So rather than just talk about it, do you have a graphic that Megan can show?
I have
Well, right behind me.
Yeah, it's behind him, and I have the link that I'll post in the comments, and I sent it to Diana as well.
And I did send you, Megan, a couple JPEGs.
Oh, you did? Okay, perfect.
Yesterday, yeah.
So let's make sure we make sure we post that link, everybody. So the team that you have on here, Mike, and just starting off, you know, is with the way I see it is you got Ryan Stacy Hills. Ryan is a huge mortgage veteran, but also has an amazing show that he produces that's very well watched. And Andrew Berman, who's been in the publication business and has an amazing publication that goes throughout the mortgage and real estate industries. And then you see the two guys there, Mortgage Shots. These two amazing people have they produce every day probably one of the most watched shows and the most watched show in the mortgage and real estate industry. So we're going to try and get the media out there for you, Mike, and first of all, help people and answer their questions, but also we want to make sure that we can do the best we can to have individuals buy your book too, because that'll help them too.
Thank you very much.
You look great, Mike.
Thank you. You do too.
Well, look what I got. I got my thermometer here, so I've been monitoring myself. Mike, I've been going. We got a skeleton crew here at the office, Mike, but I go around every day and I take everybody's temperature.
That's actually the law in Ohio now.
Is it really?
Yeah.
So we're going to ask you all these things like, what's the first symptom? You know, I could be taking my temperature and I think I'm in the clear, but I might be wrong, right?
Well, the interesting thing is, you know, you can be absolutely asymptomatic for now. You know, I told you it's 5.1 days is the average incubation period. So it's 3 times that, or literally 15 days, which is why they're self-quarantined for 14 days. They come close. Okay.
Well, we've all got a ton of questions for you. Megan, you've got a list, I know, that we're going to go through together. So Mike, just to kind of give you some idea, we're going to ask you about the new drug that the malaria drug, the chloroquine, hydrochloroquine. Yeah. So we're going to ask you
about old drug.
Right, that old drug. We're going to ask you about that. We're going to ask you, we're going to ask you what you think in general. If we can get to a team, let's remember to ask Mike about longevity, what he thinks is for longevity, because Mike is the foremost expert in the world on longevity. And then what we're going to do, Mike, is we've got some other questions Megan's got, and then I know that that Brian and Frank and Andrew and Ryan all have really, really important questions for you. And then they'll be coming in and everybody will be monitoring, so they'll kind of get what people are asking.
Perfect. And tell me what you guys were talking about with mortgage when I came on.
Oh my goodness! So
it sounded like it was an up and down day.
There's so much turmoil, and there's reason for that, Mike. So what we're going to do is we're going to, much of what happens depends on how this virus, people are asking what's going to happen here. And our response oftentimes, well, tell me what this virus is going to do in the next 30 days, or 60 days. So we need you for that. And then afterwards, all of us will kind of talk about some of the things that are out there and what to expect. Why are rates elevated? How long are they going to be elevated? What to explain to your customer. So I have all that ammunition ready after you give us the medical stuff. So we want to start with you answering questions, because that's the most important thing.
It'll be most fun for me.
Yeah. Hey, so Mike, so before we go live, guys like Frank, who's on the call, and myself are, we're not spring chickens. Okay. So now, Frank, I hope it's okay with you. I just love you like a brother. So, Frank had a heart issue not too long ago. And Mike, I remember when you did my test back in June, you said, Barry, you're in good shape and everything's good and you're going to be around for a long time. But you said you have a little bit of plaque. So for guys like Frank and myself, because I know what you're going to say on this call, how concerned should we be personally?
On a 0 to what scale?
You guys all muted?
I don't know. Give us the Mike Roizen scale. Tell us whatever you want to tell us here.
So on a 0 to 100 scale, having plaque means that an inflammatory response that's really a big inflammatory response, like a full-blown flu, shaking, chills, you'd be an 80 in worry, meaning that's when you break off plaques that go to your heart, that cause heart attacks, that cause arrhythmias, that cause strokes, that cause memory loss. If you don't have that, if you've got a relatively asymptomatic case, you're a 2 or a 3 on a worry scale, not very much. So it really depends on how your body is reacting to it. The majority of people who die after the flu, after the regular flu, that's influenza A and B, die because of heart attacks and strokes, not because of the flu or pneumonia from the flu. So the point is, if you want to say how should you worry about it, if you're over the age of 50, you've got atherosclerosis in America if you're typical, and you should be worried about getting.
Does that mean you should take things to prevent the chills, like, you know, things that reduce fever? Would that help, or that's not going to help?
Yeah, anything that reduces inflammation helps a great deal. So aspirin, baby aspirin, if you don't do extreme sports, you don't go skiing without a helmet, you don't race motorbikes, etc. If you don't do extreme sports, then taking things that decrease fever as close to getting it to close to 98.6, if you will, and getting rid of the chills is a great first step, and making sure you have a lot.
We need to go on, you guys. I'm going.
Let's go on. Let's go on, Megan. Well, hello, everyone. We are so glad to have you on here. I am thrilled today that we are bringing you this Facebook Live with this very, very important breakdown of what we're seeing with the coronavirus, questions that you might have, certainly questions that we have. Before this even started, the panel that you see of leaders within the industry, we're kind of asking the famous Mike Roizen, Dr. Mike Roizen, some of these things more on a personal level, and Mike was giving us some amazing information that you just can't get. So I think this is going to be an incredible call. And then once Mike gives us some information, we will then try to break it down between all of us on this call to tell you what we think this means for housing, what this means for interest rates, what this means for the stock market, what it means for the overall economy, and try to explain to you why you're seeing some of the things you're seeing. The Fed cuts rates a point, mortgage rates go up a point. We will break all of that down and more. First, my teammate, Megan Anderson, who is a real trooper. Megan, Dr. Mike, you might have to talk to Megan after the call and maybe kind of find out. Megan's been under the weather. We don't know. She hasn't taken a test, but
no, it's so hard to get testing. It's crazy, which is one of the things that I really want to ask Mike about on this call as well. But I'm coming in from the sick person's perspective, and I'm happy to be here.
Yeah, so she might be able to give us some chronology on what to expect, Dr. Mike. And we have on the call with us, all dear friends and leaders in the industry. We see there Brian Stevens, and somewhere behind him is Frank Garay is going to be showing up as well. You've got Andrew Berman is on the call. You've got Ryan Stacy Hills. There's Frank. You've got Clayton Collins. But the star of this show today is someone you've heard me mention his name many times. And I say this to Dr. Mike Roizen, is that I consider him a gift to the world. He is certainly a someone to me who is a gift to me personally. I am so lucky and blessed, Mike, to call you my friend. His resume is extensive. You've seen him do work with Dr. Oz. He is the foremost authority on longevity, and maybe we'll get some tips on longevity from Dr. Mike and what he sees. But he is as high up as it gets at the Cleveland Clinic, and on the cutting edge, and just an absolute prince of a human being. So thank you for joining us, Dr. Mike.
Thank you. I feel the lucky one to know you, Barry. So thank you.
Thank you, brother. Thank you. So, Doc, we're all worried about this coronavirus. It shut down the economy. And while that presents a whole host of problems, please help us understand from a personal level for all of us, how worried should we be? and what can we best do to help prevent it and help us deal with it and cope with it if we come into contact with it?
Well, the phrase was, if you don't have a chronic disease, you're not immunocompromised, meaning taking things that suppress your immune system, you don't have diabetes, hypertension, heart disease, cancer, known diseases, arthritis, then you're probably not at a great risk. The problem with that is that now those under 40 are, if you look in the Florida videos, are partying on the beach. They're actually getting fairly sick and going in the ICU. And we're losing some of them. So in fact, the point is you want social distancing for all of us. Now, if you have a plaque, the thing that kills people with the usual flu, if they have heart disease, stroke, they're over the age of 50, is in fact you break these plaques off when you get severe flu. So if you get and the wonderful thing about the flu shot, influenza A and B shot, which we get as a standard shot, is that if you get it 10 years in a row from 50 to 60, the data are you decrease your risk of hospitalization by 50% over that 10-year period, mainly from heart attacks, and decrease your risk of a heart attack killing you by 25%. So the real benefit of getting the flu suppressed by vaccines is you don't have a large inflammatory response, which causes plaques to break off. It also causes, over the long term, you to have a damage to your lung, which allows the secondary pneumonias and the pneumonitis that we're now seeing. So should you be worried? Yeah, and you want to, as the question came up, I think you asked the question very beforehand, do you want to suppress the fever? Do you want to suppress the rigors? Or do you want to let it go and get rid of this by the heat of your body killing the bacteria? No, you want to suppress it because of the vulnerable plaques that you could break off and cause heart attacks, strokes, memory loss. The worrisome thing with the heart attack, the reason people die quickly is they have arrhythmias, and those abnormal heartbeats kill you. So yeah, you want the people over the age of 50, you want to suppress it as much as possible. So that's where aspirin and Tylenol come in big time.
That brings up an important question I want to ask, because there's been a lot circulating around that we should avoid ibuprofen.
Yeah, so what ibuprofen does theoretically, we don't know in humans. There's some anecdotal reports from France apparently, but when we've tried to investigate them, we can't find how good they are. So the Dr. Oz medical team, we've tried to look at it. And what ibuprofen does is it stimulates growth of or presence of one of the receptors that the virus can dock on. So it's a small increase, in the test tube studies, it's about a 30% increase. Conversely, if you will, one of the therapies, chloroquine, decreases it, these receptors by 30 to 60%. So that's why chloroquine in vitro studies is now being tested by the World Health Organization in large scale in the studies in the Italian ICUs, we're told. 100 patients, randomized study, 50 get the chloroquine, or actually they're getting Plaquenil, which is hydroxychloroquine, which is more, which has less side effects than chloroquine. So they're getting that, and in 50 of them, 50 are not. That's at least what the study we were told was. And we should have, and I was wondering, did the president, when he approved or was pushing the FDA to approve chloroquine for this use, did he have the data? And apparently the Italians have not released the data, if they have it, yet. So they're about a week into that study, as we understand. And in 2 weeks, if 40% of the people in the ICU are dying, in 2 weeks you should have a pretty good indication whether that's effective, at least as a treatment against the pneumonia. So the pneumonia is what's killing the younger people, and some of the people who are older have emphysema or lung disease. What's killing the majority of people 60 to 80 is still the classic break off the plaque, cause heart disease, and they have an arrhythmia and die. So different mechanisms, but at least the key point is keep your inoculum as low as possible, in fact, to zero, by keeping away from people.
So Doc, let's just break down those things just so we make sure we get our arms around them. So first, sticking with the breaking off the plaque, and that happens if you have the flu-like symptoms like the chills and things like that because of fever. So what would it help if you're saying it would help if it would reduce the fever, and you mentioned aspirin, Tylenol. Would you suggest an ibuprofen as a way to suppress the fever, or would you first reach for aspirin and Tylenol?
Assuming that you don't do extreme sports. So you want to check with, in this case, you want to make sure you can take aspirin safely. You don't have some clotting disorder. You don't do extreme sports like motorcycle racing or skiing without a helmet, etc. Assuming you don't do those, then aspirin is a very useful thing to take to decrease fever, as is Tylenol. And because of the worry about NSAIDs and the increased receptor docking for the virus, you'd say, okay, I'm going to take aspirin or Tylenol and not take a non-steroidal like ibuprofen.
It's very important, everybody, to listen to that. And is there any kind of prophylactic response? Should you just as a prophylactic response, kind of, maybe if you don't have any symptoms, if you don't have anything, but you are over 50, and what I'm taking is that many people over 50 have some plaque that they've developed, that you may want to take some aspirin as a prophylactic or some Tylenol as a prophylactic?
So I take, as I think I've told you, I think almost every patient of mine over the age of 50 should be on twice a day baby aspirin with a half a glass of warm water before and after. Why the warm water before and after? Because 70% of the side effects of the aspirin landing on your stomach lining and causing bleeding, you reduce those to almost zero if it lands in the warm water and dissolves that way. Why twice a day? Because 34% of us have aspirin resistance genetically to once a day aspirin in its cancer prevention, not its clotting prevention. Almost everyone will get a decrease in clotting with it, which is why you don't want to do it if you do extreme sports. So I believe almost everyone should be on twice a day, morning and evening, baby aspirin landing in a glass of warm water.
Well, that's very good advice. So now, Doc, if we were to take it to the next level, which you already went into, but Megan, I know that this is something you had on your list of questions, and it's something that we've been talking about here because as it's come out, there's an old drug, it's a malaria drug, and I believe that the purpose of this drug is to suppress the immunoresponse, and that is what you talked about earlier. So can you tell us your thoughts? I know you went through it, basically you covered it a little bit in general. What are your thoughts? Is this something we should have hopes on? Is this something that is going to be a panacea? What do you think about this chloroquine or hydrochloroquine?
We don't know. In the test tube where it's been studied, and you want to go to, and I'm telling it to you as a group, we'll probably run out of it, but Plaquenil is hydroxychloroquine, much safer, many fewer side effects than the chloroquine itself. Chloroquine itself, when you get to a certain level, causes retinal disease and blindness. So if you can get to hydroxychloroquine, now it's taken during malaria season, 200 milligrams a day just as a routine to prevent it, and then you go up on the dose, 400 milligrams twice a day for treatment. And that looks like in the studies that look at blocking this lung receptor. So will it stop every problem? We don't think so, because most of the problems in muscle, the shaking, chills, etc., are a receptor in muscle, different than this. But maybe it stops these immune cells from docking as well and stops some of the severity. That's the hope. there are anecdotal reports from China and Korea where they gave this to people in the ICU and they thought they survived better. No real study on it, just a few reports. So what's happened now is there is and the test tube data is real. The test tube data is, this is pretty darn good, 60% decrease in the docking stations on the lung cells. So that data is pretty good. So that's why the World Health Organization is now doing a real study with this at the right dosage. They pick that 400 milligram twice a day dosage. They give it IV to get the same level in the Italian ICUs. So if it works, because of the way, we will know whether it's a treatment or not for the most severe cases. What we do know is a treatment, I'll come back to in a second, because the immune serum, and you might even find an easy way of getting it, which I'll talk to in a few seconds. So I'm teasing, if you will, of how to strengthen your immune system, but we'll come back to that. But in fact, we should know in 2 weeks if the Italians have done the study right to be able to answer it. The Italian medical system in Milan is now in that area is now in a real crisis, and it's hard to understand why, other than they didn't have emergency preparedness there either, and people must associate. So what's the mechanism of transmission? It is definitely droplets. So you sneeze, you get droplets on other people. Those people, if they get them inside, that's a mechanism. Second is, it was worried that it was aerosol, then it was worried then it was hoped that it wasn't. It looks like aerosol transmission does occur. That is, the virus lives in air for a period of time. Why is that important? Because in systems like an apartment building or an office building where you recycle air from here to the next room, then if one person gets it, you're recycling it to them, unless you've got filters that have ultraviolet light in them or some way of killing the virus as well. The third way is one that Paul Offit, who's a real expert from the University of Pennsylvania, worries about. And he said most of the people, when he's looked at the case reports from China and Korea and Japan, these people have gastrointestinal symptoms. That is, they have diarrhea or other symptoms with it. Megan, I shouldn't ask you medical questions, but did you have any GI symptoms with it?
I did. I had exactly what you're talking about there. It was not.
Yeah, so that's common with the flu, and it's common with coronaviruses. That means there is what we call fecal oral transmission through food, through people touching food that have it, or the viruses being breathed onto food, which probably means, you hate to say this, but at least Paul Offit would probably say, we shouldn't be eating food that we don't cook ourselves to kill the viruses. That is, takeout food, if you don't heat it up real high, isn't probably a good idea. You want to make sure you're cooking the food yourself. So I guess it's those bistro and blue, whatever it's called, the services that provide you raw food that you cook yourself. That's okay, because you're cooking it yourself and going to kill the viruses. But the food that you get as delivered by Uber or Dash or whatever they are, maybe not, unless you reheat it to a very high degree of temperature, 165, to kill the viruses in it. So the point is, we don't know whether it's fecal oral. We worry about that. How long will it stay on your iPhone or other things? It looks like up to 3 days. So that's that in cardboard that you get on the blue, whatever it is, and the bistro, etc. 1 day. So that's the problem. So if you I would say to people who are in the supply chain, don't get anything airship from China. Get it ground ships because it takes long enough to kill the virus on the way.
Mike,
Now, when people do get packages, should they be spraying those down with Lysol before they even touch them?
No, because I know if you spray it down with Lysol, what's it going? You're going to still touch it. You're going to go inside it, right? So just wash your hands well before you touch yourself with your hands.
Okay.
Mike,
Yeah.
sorry, Mike. What? I just want to talk bigger picture here for a second here, and I know there's no way of knowing this, but I guess what I'd like to understand is what percentage of the U.S. population do you think will wind up having this at one point?
We don't know how this is how it's going to pass from, if you will. So if you look at the Korea and China data, there were no cases in China today. If you believe that data, and I'm hoping I can believe it, then it's possible that social distancing will make it rare enough so that the warmer, we don't know why warm weather has viruses go away, take a vacation in the summer months, but they do. It's not that they're totally gone, but they're really at low levels. We don't know whether it's the sun has more energy to kill the virus or whether it's people's, whatever it is. But if you think that it's going to go away, as I do, 80% chance it goes away. 4 of the 5 prior coronaviruses go away in April. We should start to see a decrease in the number of cases and the deaths in late April, mid-April. We should see a decrease in the cases, but we haven't been testing, so you don't know what that's going to do. I mean, we can talk about the testing problems. One of the most interesting testing problems, Barry, I think I told you about last night. It is we've run out of swabs, the long swabs. They're only made one place. They're made by 2 factories. Both are in Milan, and they're both on lockdown. So we can't get the damn long sterile swabs. There will be some others made, obviously, but we haven't been able to get those. But in any case, the point is we haven't tested widely enough to know what it's going to be. I got asked by another famous real estate guru how many cases, and I said someplace between, we're going to have 500,000 to 5 million in the U.S., and we'll have between 5,000 and 50,000 deaths, and then hopefully it will go away in April. Hopefully we will get a vaccine made, and they're wonderful companies now, 4 companies competing on it. Who did that? Fauci was brilliant. January 3rd, NIH had enough budget. He let 4 contracts. CDC didn't have enough budget. They didn't let the contracts for the testing because of the budget and emergency preparedness cutbacks. But in any case, the Fauci did, and 4 companies are competing. I guess someone's in Seattle there. And are you there, Megan? I can't remember. You're there.
Ryan's in Seattle.
I'm in Seattle, guys.
Yeah, and one of the companies is already started the safety tests in Seattle. I know another one has started them in Philadelphia. So there are at least two of the companies are in human safety testing already.
So Mike, first of all, I think I speak for everybody here. We really appreciate this. And I know we've got a great panel here, and I know everybody's chomping at the bit. So I apologize for kind of just trying to get some of this stuff initially framed out first with you and I, because we've talked about these things. And I want you to just share with everybody what you shared with me, which is a concern is two points. One is, what's my chances of getting it if I come into contact with somebody? Because we know measles was terrible, right? Everybody you come into contact with, you get the measles. So if I come in proximity or come into contact, or even if, let's just say, they do sneeze on me, am I guaranteed I'm going to get it, or can I fight it off before I get it? And then the other thing is can we talk about incubation? Because so many people that are listening to this are worried. They said, goodness, I was in an airplane, or I was in a big crowd, or there was somebody that was sick that was near me. What are my chances? Or maybe I even know somebody that has it. How long do I have to wait beforehand before I could cross off that as a possibility? So could you address those two things for us?
Yeah, so the problem with this coronavirus, and it's a real problem with it, is you can be asymptomatic and transmit it. Very rare in flu and virus lands. And consequently, the average incubation time is 5.1 days, which means 3 times that, we say, is the time you could be asymptomatic and transmitting it. 15 days, which is why we have the quarantine of 14 days. So 15 days you could be transmitting it. It's 90% are transmitted within 10 days, and probably I think it's 68% within 5 days. So that's the point. Now, how transmissible is it? Well, we have a phrase for R naught, which is the calculation of if one person spreads it. Measles is 18. So one person with measles will spread it on average to 18 people. It's pretty darn spreadable. The average flu, I think it's around 2. We think this is a little more spreadable than the average flu, but no place near measles, so in the 2 to 3 range. How easy is it to get it? If you're around someone, in other words, if Megan was in the room with you and she, God forbid, had it, it might be, I'm hearing an echo now. I don't know what
there's an
I'm
echo
doing.
there. Could somebody just mute, please, guys? Just mute unless he's...
So probably 2 to, it's 1 in 10 if you're in the room with Megan and not sneezing. If she sneezes on you and she's got it, it's probably, 20% or something like that, or 30%.
Well, that's very encouraging, Mike, because it doesn't mean like somebody sneezes on, you're guaranteed to get it.
No, and especially if you wash frequently and you wash before you eat. If OFID is right, and the fecal oral route is a major source, then washing is really, really important in addition to social distancing.
Got it. Okay, Megan, but before we go to everybody else, could you there's a few questions I know that you compiled, and Megan kind of could be a little bit of our case study, Doc. Maybe you can kind of ask Megan and she could kind of walk through so everybody knows, because Megan was feeling ill. You thought that you might have actually been in contact with this and had it, Megan, based upon it. So I'll let you ask the questions that are common, and then maybe you guys could talk about it, and we'll open it to everybody else.
Yeah, so I want to start off with some questions that we got from our users and subscribers. And the first one is, does your blood type alter your chances of getting corona?
I read that today, that blood type O is less likely. We do have what are called histocompatibility, and certain blood types might have more receptors than others. I didn't have time to read the article to see whether it's, if you will, a true scientific report or whether it's part of the internet lore. So I don't know the answer to that.
So here's another question. Let's say that I do have corona and I start to feel better. How long after that time period can I feel comfortable and safe with going out in public?
The data, the Cleveland Clinic data on that is asymptomatic plus 7 days.
Okay, perfect. And another question we got is...
Now, some other places are saying asymptomatic and 2 days, and then retesting.
Testing is so hard. Can we talk about testing a little bit too? I know we talked about the fact that we're out of swabs.
Once you get it, they will be tested. They're willing to retest you, because there is one guy, he's been on every TV show, who, after getting asymptomatic, he had it, he got asymptomatic, he's still shedding virus 22 days later. So we are testing people when they get asymptomatic to make sure they aren't shedding virus still.
So there's been a few ways, because I've been doing my research trying to get tested here, and it seems like, one, you call your healthcare provider and they work with, the Florida Health in this case to get you a test. Well, that's a challenge for some people, I imagine, especially for me. I just moved here. I don't have a local healthcare provider to contact. And then the only other option would be to check myself into a hospital, per se. And I'm curious, do you advise that to people where they're having a hard time getting tested to go to something like a hospital? Or is that more, they're going to be spreading it more there?
Yeah, we're worried about that. So we have right outside here is there's windows here, don't worry. But we have a drive-through testing center, which is we have 3 of them now in Cleveland, but we're running out of tests. So we're only and believe it or not, we're running out of swabs. So we're only testing healthcare providers and people over the age of 60 or who are really symptomatic and need hospitalization. So you go through a screening process, answer a questionnaire, you get RSV and flu tested. If those are negative, we get those in 8 minutes. If those are negative, then you can get the Corona test. If you're over the age of 60 or healthcare provider, and your physician, we go through, and in fact, I did one this morning. These are people who physician has written in the Cleveland Clinic system. Where in Florida are you?
I'm in West Palm Beach.
Okay, so you're close enough to the Cleveland Clinic system that you could actually sign up there and get you just go as an urgent care, but you can do it via a video. And then somebody like me in the Cleveland Clinic system calls you up, asks you a series of questions you trigger it. And in Florida, we have a more liberal selection process than here, so they must have better testing set up there than we have at the main site so far, or maybe more swabs. You can then get tested there and through the drive-through system. It literally is a drive-through system, and then in 1 to 5 days. Now, why is it 1 to 5 days? Because we're doing these in batches of 40 by hand. Batches of 40, because no one provided the automated system that they have in the rest of the darn world. We're getting that this weekend, so we've been able to do about 1,000 tests a day now. The demand is much greater than that, even in Cleveland. So we're doing now this weekend. I understand, I don't have it officially, we'll be able to do 10,000 tests a week on an automated system, 10,000 tests a day.
What's the first symptoms, Mike? What's the first symptoms?
The first symptoms are cough or sore throat. If you believe that, but the data off it says it may be GI symptoms are first, and then you get sore throat and cough, and then you get fever. But remember, you can literally have no symptoms for 5 days and be shedding it.
Yeah, it's crazy. I've been watching people's experience. My experience firsthand, if anyone wants to know, it started off with just a sore throat. And then I started to get a little more congested up here. And then I just started dry coughing. And then so much mucus was happening that then I started coughing up things. Now I'm on the way up. I really feel like I'm on the way up, and you're just so tired. Like, your energy is very, very low during all of this. So just listen to your body. And even if you're not showing symptoms, I think that it's really important for us to keep our distance away from people.
Did you get the flu shot this year?
I did not.
Yeah, so it sounds like you have a regular flu, not the coronavirus.
Good. This brings up another question.
Well, wait a second.
Okay.
I just want to tell you, you're stupid for not getting the flu shot, okay? But nice that you responded.
I am. I didn't have health insurance at the time.
Now, and in fact, that's what's happening. People we're testing with symptoms like that, 97% of the tests at the Cleveland Clinic, out of the first 1,400, I don't have today's results, 97% were negative. And we're negative for coronavirus. So it sounds like you've just got, and in fact, of the people being screened, it is something like 50% are showing up with regular flu that is testing positive for influenza or RSV. So I want to tell all those people, do not do what you did. Please, it's not too late to get the flu shot. Now, the good news about this is, if you will, and Barry, I just wanted to get this in. I've got I'm supposed to be on NBC TV in Portland, Oregon in 10 minutes or so. So I'm going to break away. But there are things you can do to strengthen your immune system. And what the immune system is important in the people who recover from this in China. They have taken their serum, processed it, they volunteered, quote unquote, to donate their serum, processed it, gotten the antibodies, cleaned them up, sterilized them, given them back, and they had 10 out of 10 people in the ICU who were given this recover. Not randomized study, not the gold standard. That's what we're doing in Cleveland. That's what they're doing in other places, and I guess in New York as well, to treat people with severe illness. And we don't know because we haven't done a randomized study. We don't have enough people, thank God, to do it in Cleveland. But it appears this is effective. Other things that give this, believe it or not, there is something called bovine colostrum. Cows get coronaviruses commonly, and apparently this is one of them. The bovine colostrum may be something that works on this as well. We don't know, but that's another approach people are using for, and in fact, you can take these bovine colostrum tablets and maybe avoid the GI, the first entry.
That's available, bovine colostrum tablets?
Yeah.
Like over the counter?
Yeah.
Wow.
Doctor, I'm going to ask you one
Hold
thing.
on, hold on. Let me go and say, so strengthening, and I'll be right back to you, Andrew. Strengthening your immune systems, the things that do it: sleep, stress management, really good now for financial people, right? Sleep, stress management, doing the right amount of exercise, meaning your usual amount, going maybe a little more, but certainly not marathons. Those people who do marathons do more than 2 hours of exercise, have a suppressed immune response, and get more flu and colds. Eating the right foods. So we go through with this, and you told me to come on because of the book. So in What to Eat When, we go through how your immune system works and what foods you can do to suppress it. So that's in What to Eat When. There's a chapter on immune, but it's stress management, sleep, getting a multivitamin, believe it or not, that helps twice if you get half of it twice a day. And as I said, a little exercise.
And that baby aspirin twice a day too. So before we, I know you have to go, but I know that Andrew's got a question. I think Megan's got some more, and the other guys, maybe we could do like a real lightning round with very quick questions, responses. But before we do anything, if you're watching this and you're gaining knowledge and you want to show your appreciation, Dr. Roizen, he could command all kinds of money and whatever for what I mean, just, he's a prince. If you want to say thank you, just buy his book, please. Just everyone who's watching this.
I'm putting the link to the book in the comments, and I'll also put it in the top where the video is as well.
Please do that. That's your way of saying thank you. That is how you can say you appreciate what this man is doing for you and your family right now. That's what you could do. So, Andrew, I know you had a question. Meg, you might have some other ones from viewers.
Yeah, Doctor, thank you so much for sharing this with us. I mean, yeah, and you answered most of my questions in your response that you just said. I wanted to know, what should we be eating and what vitamins should we be taking? If you had any, and obviously I am going to be buying your book as soon as we get off here. But if you can give us actually, a couple of foods.
Just do a lightning round because he's got to go.
Okay, it's avoid sugar, added syrups, simple carbohydrates. The more fruits and vegetables, especially vegetables you have on your plate, the better. And cruciferous vegetables stimulate immune system responses. Cruciferous vegetables: Brussels sprouts, broccoli, cauliflower, cabbage, watercress, they're probably arugula. The coffee is great. Blueberries are sensational. And so berries and coffee are regular coffee without the sugar and without the cream in it. Other things, that's really the gist of it. And then we can, sometime later, we'll do something on longevity and why you want to do fasting for 16 or 18 hours and eating over a 6 or 8 hour period.
Yeah, we have to do another call on that because I know when you taught me all those things to try and keep me going for a long time, Doc, that was so enlightening. We'd love to do that with you. But Megan, are there any viewer questions that we need to get to or questions you have?
Yes, I'm going to ask 2 quick questions. What about elderberry?
If you can find elderberry that isn't fake right now, you're really good because the internet supply of toilet paper and elderberry have both been bought up in excess.
But
So
good overall.
elderberry works when you first get it with colds, just like chicken soup, zinc lozenges, and high doses of vitamin C. We don't have data that it works on the flu, but if you don't know what you got, it's worth trying. There's not a harm in it for short term. You don't want to take elderberry every day. There is toxicity from zinc lozenges and elderberry taken too long. So if you want to do something routinely, have chicken soup every day.
One more question. Does smoking marijuana or nicotine increase your chances of getting COVID-19?
We don't think it increases your chances of getting it, but it certainly increases your chance of dying with it if you do get it. So it is vaping, smoking anything, e-cigarettes and regular cigarettes are the common things, or smoke, but it's smoking anything hinders your lungs, what we call your brooms. You've got things in your broom. The first part of your immune system is your skin and then these cilia brushes. They get all the junk out of your lung much better, and it hinders those tremendously, and it makes the surface of lung cells more vulnerable for coronavirus docking and entering and causing severe problems. So yeah, cigarettes are any kind of tobacco, any kind of smoking is bad for you.
Dr. Roizen, this is Clayton Collins at Housing Wire. I want to jump in a little bit and tie to some industry perspective here. We have real estate agents that are still out doing open houses and showings and interacting with homeowners and home sellers. And we have loan originators who are trying to close loans and touching closing docs and application files. Can you give us a little advice for the professionals that are still out there in the field working with homeowners and consumers, as well as those who are touching physical paper, and how long the virus may live on those documents and how people should be thinking about safety in that interaction?
Physical paper, it looks like 3 days it can live on it. So the key point is you're going to have it on your hands. You're not going to breathe it in or get it. So wash, and it's really tough. So, how do you do this? If you put gloves on, you will tend not to then touch your face and food with the gloves on. So wear gloves if you from the mortgage origination agent prospect. Now, from the agent standpoint who's selling, I would try and do video sales. I don't know how to, I don't know your business, obviously, but in ours, we've gone 100%, unless have to have an in-person meeting. Cleveland Clinic has gone 100% to televisits. And so this is as close as we tend to get to people, if you will, through the computer.
Brian, Frank, Ryan, you guys have a question for Doc?
Yeah, I'm 48 years old. I had pneumonia 10 years ago. Does that put me at a higher risk?
Probably not, unless the pneumonia caused chronic lung disease. So if your pneumonia was so severe as it damaged your lung permanently, and you can see that on X-ray. If it did that, or it started because you smoked, then yes. But most times, the walking pneumonia, the pneumonias that young people get, usually no problem, and no increased risk.
So you're saying this Lysol here is not helping anything? I'm spraying everything in my office.
He's literally spraying us.
I'm spraying everybody with these Lysols. I got a whole bunch of cans of these a couple weeks ago. Does this not help? When I spray all the handles and the bathroom and the areas that we tend
coming into your office other than you.
Well, I mean, here's the thing is, the kids who work in our office, they're coming in contact with their friends.
But then so what you want to do is keep that as clean as possible. So yes, it may be helpful.
Send them home. All of our employees at Housing Wire are home. I'm the only one here in the office today, so I'm spraying myself down.
We're out here in Solano County, so we were just told today to to stay home. So
yeah,
this is gonna be the last time in the office for us.
So take your computer home.
Ryan, any questions from you, my friend?
Yeah, I mean, we probably don't have enough time for my question, which is okay, but this has been so good.
Go ahead. I got 6 more minutes before I have to go.
I just want to unpack the statement that I wrote down, which is we should know in 2 weeks if the Italians got it right. I think the hope is that we have a treatment ready to go here, but if I'm hearing you right, we still got to wait to see if Italy, which surpassed China in deaths today, got it right. Is that accurate?
Yeah, well, it's not Italy. The World Health Organization is doing a randomized controlled trial using Italian ICU patients, 100 of them. And so it is, does this treatment work? Half of the people out of the 100 will get the treatment, half will not.
Gotcha.
And we will, and there may be a dosage regimen, but it wasn't stated in the study out of the World Health Organization. If
Gotcha.
they did get it right, we will know in 2 weeks that this treatment works or doesn't. What we think works now is, in fact, for the sickest is taking the antibodies from the volunteers who have recovered and giving it to them.
Gotcha. That
Hey,
makes
Doc.
sense.
So we appreciate this so much, and I know you have just a few more minutes, and then we're going to kind of talk about this amongst ourselves and how it affects the people watching from a business standpoint. But this has been beyond what we can even put into any kind of quantitative value. It's so beyond that. So we're all grateful. But Doc, before you leave, and you're such a prince to even want to give us the last few minutes, could you tell us your thoughts on timing, your thoughts on when this starts to get better, when we might be able to see a treatment that helps people, and then most importantly, when there might be a vaccine that eradicates this thing?
So there are 4 companies, they're pushing on the vaccine. 2 of them are in human safety testing. Both of those companies have said, Moderna and Inovia, I think are the 2, and they have said that if they did 3-month safety testing rather than 6 months, they could have it in quantity by October. I don't know how valid those statements are, but those are the statements that they made publicly, I think, at the press conference. I think it's only a week and a day ago that the president had the vaccine manufacturers in. So that's that. Treatment, we just got to see what works. We're going to do some experiments. Obviously, hydroxychloroquine is going into at rapid FDA testing. The president said that today at the press conference, and we know that it is in trial by the World Health Organization. We know that the immune serum looks like it'll work. We'll have, in New York, we should get out of New York a randomized trial on that in maybe a month. They've got enough cases to do that. As far as prophylaxis, that is, what should we take and what should we do until then, and what's the time course? As I said, 80% of the coronaviruses go away starting about April 1st. If that happens, you should see the absolute case numbers. I don't know because of the testing parameters weirdness, but we should see cases drop in the United States, deaths start to drop off by mid-April, and you'll be able to resume somewhat normal life in the Northern Hemisphere by May 1st or late April. In the Southern Hemisphere, they're supposed to get it now, meaning until we get a vaccine, it is places below the equator that normally get what we had as a viral infection. So from a world standpoint, I'm worried that all those countries, if you look on the Hopkins map or the CDC map, it is places below the equator that don't have it. You don't see it in Africa. You see very little in South Latin America. You see very little in Australia. I'm afraid it'll bounce up in the Southern Hemisphere countries. But in the Northern Hemisphere, if we're lucky, and the projection is we should be lucky because of what coronavirus history is, 80% chance we'll be able to resume more or less normal life by mid to late April.
That would be amazing. And Doc, you told me that this is unlike a chicken pox virus where it lives on the nerve endings and it comes back like shingles. This, if you get it, God willing, it should be over. But then also, if you get it, are you then somewhat immune to getting it from somebody who has it?
Yeah, there are a few people who have recurrent in the Yeah, I think it's the Japanese or Korean studies, but very few. So we think your immunity, the antibodies you produce to it, help stave it off forever, or at least for a while.
So, Doc, I don't even know how to thank you, just as my dear friend, for doing this. For you just
Are you kidding?
you
It's
don't-
my privilege. Thank you.
people who don't know
Thank you so
you
much.
don't know the size, the giant size of your heart, and how genuine and wonderful of a man you are. But I think they've kind of gotten a feel for the type of person you are, Doc. God bless you. Thank you. Please, 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 you stay safe, because the world's a better place with you in it, and we need you to be healthy and safe so you can help all of us. Thank you, Doc.
You're way too nice. Thank you.
Thank you, Doc. And please, everybody, you got to buy his book. And while we'll let Doc go, we're gonna kind of keep talking to you now and tell you what we think this means for everyone else. So thank you, Doc.
Thank
Goodbye.
you.
I'm gonna
Sorry.
give you a round of applause, by the
No,
way.
I'm sorry. I had
Thank you so
limited
much,
time.
Doc.
So
Thank
good.
you.
So guys, here we are. We're all together, and those of you still watching, I'm just blown away by all the information that we just got. Probably more than we've ever been able to even imagine or research. But I'll turn over to you guys now for where you what your thoughts are first from Doc, and also what you think the next topic we should start to work on with people here.
I'm hearing a lot of rumors about non-QM taking place right now. That market's being hit real hard as we speak right now. I don't know how much of it is rumor mills, but my phone's been blown up. Can we talk about that? What's the immediate future of non-QM?
So here's you bring up such a great point, and as normal, you guys are right on the pulse of the market. You're hitting dead on what a very important topic is. So this has to do with why have rates gone up? This is something everybody's going crazy because the Fed cuts rates by a point. Your customer wants a point lower, but mortgage rates went up by a point. So why is that happening? Well, here we go. So number one, we have to understand the Fed funds rate is not your mortgage rate. And what I'm going to do right now is I'm going to show you, I'm going to pull up a chart here just to show you very quickly what the difference is. And, Megan, maybe we could take this and we could post this chart so people could use it. So what we see here is we see, first of all, that the red line is mortgage rates. And this goes way, way back here to like in the 1970s. And the blue line is the Fed funds rate. Now notice, the Fed could jack rates up, mortgage rates come down. The Fed jacks rates up, mortgage rates come down. The Fed lowers rates dramatically, mortgage rates barely budge. Fed raises rates, mortgage rates come down. Take a look, the Fed takes them way down, mortgage rates barely move. The Fed jacks rates up, mortgage rates barely move. Fed takes it to zero after the Great Recession. Mortgage rates just trickle lower over time, and here's the latest move. So bottom line, team, is that we have a situation where we should know that mortgage rates and the Fed funds rates are two different things. The Fed funds rates, what banks charge each other overnight. Mortgage rates are going to be out there for 30 years, so there's a different thought process to them. Why do I bring this up? Because rates went up, first of all, in the face of this. Because why? Because when Secretary of Treasury Mnuchin came on, he said two things. He said, we need a huge stimulus package. We need a huge stimulus package. Otherwise, our economy is going to be in big trouble. And listen, you can understand that. We want to help people. But $1,000 for every person, bailing out businesses, giving these programs and grants, this costs a lot of money. The government doesn't have money. The way they get money is they borrow it by issuing treasuries. This shock to the system of trillion or trillions of dollars, it's just a supply and demand issue. Much more supply than the market is prepared to absorb. And while it can't absorb it all at these levels, at higher interest rates, there becomes more appetite to absorb it. That's why you saw interest rates rise. But the second thing Mnuchin said answers your question, Brian. So sorry for the long answer, but I wanted to give the background of it. So when Secretary Mnuchin said, if we don't do this, we will have unemployment reach 20%. Now, please put this in perspective. 20% during the Great Recession, the depths of it, the financial crisis, Lehman Brothers, housing bubble, all the problems, unemployment was 10%. During the Depression, it was 20 to 25%. And that's why rates went up, because when rates go up, when you look at other market conditions, that's one thing, but a new risk now has presented itself. If we hit 20% unemployment, I'm not saying we get there, but if we did, then what would happen is that people's ability to repay their mortgage becomes a new risk. And for that additional risk, rates go up. Now think about your QM products. They tend to, but not always, be a bit more of a, for lack of a better term, a riskier transaction. So if we get higher levels of unemployment, if we get a prolonged downturn in the economy, QM transactions become the first domino to fall. And maybe that's the problem, is that it's added risk, Brian.
You mean
Barry, you mean non-QM, right?
Non-QM, so that's a,
Yeah.
Forgive me,
Okay.
forgive me. I'm trying to speak a little bit too quickly. So forgive me, and thank you for clarifying.
Yeah, so I talked to Bob Brooksman at the NBA about that this morning, and we talked about. I mean, at Housing Wire, we've seen no less than 3 pause letters today from non-QM lenders. I'm hearing from a few other folks in the market that there's no more than 3 non-QM lenders active in the market right now, and that's all kind of pointing back to warehouse lines and people getting that margin call and squeeze last week as rates move so quickly. Is that in line with what you guys are hearing, Brian?
Yeah, that's exactly what we're hearing right now. And so, this reminds me of 2008, but it seems to be coming at a much more vigorous pace now. It's just fast and furious. And, I'm not sure what the rumor mill is or what in fact is taking place. I did call a couple of our non-QM sources, and they did verify that they're starting to have liquidity issues, that they're going to change their underwriting guidelines, that the rates are going to increase, and they're going to, by design, be pushing less volume through, if they're even pushing it at all right now. And again, because it's a rumor mill, I don't want to get into the names of the companies. But I heard, one of the non-QM companies who's fairly big out there is not honoring their existing locks right now.
I saw that as well. So Barry, you talk about the risk associated there. I mean, a lot of the non-QM loans are going to entrepreneurs and kind of riskier borrowers that maybe have a higher impact from a recessionary risk. Maybe not your typical W-2 employee. How are you advising loan officers to think about that right now when they have those borrowers that might be coming in and looking for low rate on purchase or refi? What should they be advising? Maybe, Ryan, it'd be interesting to hear your view there too.
Well, Clayton, you hit the nail on the head. I mean, these are the exact type of borrowers that will have a more difficult time if non-QM continues to tighten up. What I would be advising loan originators is to listen to the words from Dr. Mike Roizen again, because quite frankly, he painted a picture that suggests that while this is not going to immediately get better, there is light at the end of the tunnel. And based upon what he was talking about, timetables, April, May, let's just see, even that tends to be optimistic, June or July, it's an inconvenience, but it's not devastating, right? So if you have to wait a couple of months to get transactions done on a purchase or even on a refinance, I think that's probably something that we'd all, at this point in time, I think we'd all sign up for that, right? So if that's the prognosis, that's the advice I'd give, is patience at this point in time. Let's take care of one thing at a time.
Hey, Barry, 2 things that I'd love for you to clear up, because you're so good at this. This show's crossing over into mainstream. We have a lot of consumers watching. So at a 5th grade level, because this is what you're great at, can you explain what Clayton and Brian talked about, margin calls, and then also non-QM? I want them to stick around and listen to this, and I don't want this to be over their heads.
So here's the thing. When we try to explain why mortgage rates have gone up in the face of the Fed lowering rates, the Fed lowered rates because what's so important to them is to protect our banking system. And this is really critical, and this is where it can get scary for us. So let's just understand how our banking system works, and we'll try and do this quickly. When you deposit money in a bank, you're lending them money, and they oftentimes will have money available if you need it, but they don't have all your money available. They're required to have 10% of it available. The other 90% is in the open market, that they're making investments to get a greater rate of return than what they have to pay you. And that's how banks make money. It's a wonderful system. But from time to time, more people want to take money out than the bank has handy. Our system contemplates that it's called a repo system, a repo market, where one bank, Bank A, can go to Bank B and borrow money from Bank B temporarily till this washes out. Now, the Fed said, we're going to make it easier for Bank B to lend money. We're going to drop rates. We're going to make it easier for you to borrow money. We're also going to eliminate some of the restrictions that tied up money according to the stress test. They did all those beautiful things, which was great. But what if Bank B doesn't have the money because Bank B's customers are looking for it? That's when the Fed came in and injected liquidity by saying, listen, don't worry, send us to us. We'll buy it. We won't lend it to you. We'll just buy your assets so you have liquidity. And this is what the Fed is panicked about right now, because the reason why they're throwing these trillions of dollars out there is, imagine this worst case scenario, team. I mean, this is where it gets scary. People that are out there right now, these poor people that are not working, maybe some of them are listening right now, and you're out of a job, and maybe your employer is nice enough to pay you for a period of time, but we know that that's temporary. And even if the federal government comes and gives you some money temporarily, you know that that goes pretty quick. So maybe you have to go to the bank and access your savings. The worst devastating thing that can happen in this country is you go to the bank and the bank can't give you your money. That's what the Fed is trying to do, to try and help us right now to make sure that our banking system is working. So that is the first thing that the Fed's trying to do with these actions. So when you hear these trillions of dollars, when you hear all this stuff, that's what the Fed is trying to do. Now, to answer your question more specifically, now that we know that the Fed's trying to do, what does this mean for people in our industry and for people working with mortgage companies? You know, when rates drop, everybody thinks it's a big party. It's not such a big party on the other side of things, which when you service loans means you're maintaining that loan like a superintendent in an apartment building. You pay to be able to do that, and you get paid a fee, but it takes a few years to break even on that. So as loans refinance, you lose money. That's a problem. As we're trying to get loans done and processed, and now people working at home, which means less efficient, it's more taxing on the system. So when we see all of these things occur, lenders are losing a lot of money there. Now, here's the other thing, is margin calls happen. Now, rates going up, believe it or not, was one of the best things for the mortgage industry because of this, because of margin calls. Now, here's what happens when you lock a loan in with your lender. It's not like it gets magically locked. The customer goes to a lender, lender says, okay, you're locked in at 3.5% or 4%. It doesn't magically lock. That loan will only lock when it's closed. So in the time that you locked in with the lender through the time that it closes, that lender is making a promise to you, and that loan could go up or down in interest rate, and the lender will have to buy that rate at closing for you. So how do they protect themselves from losing money? They, in essence, they buy kind of an insurance policy. And if you've ever shorted a stock, you know that what will happen is if the stock gets worse, you will make money. So if rates get worse, this instrument allows them to make money. So that if rates were locked at 3.5 with the customer, but by the time you close it's 4, this instrument gives them enough profitability so they could buy the rate from 4 to 3.5 and keep their promise. This works beautifully. But when rates come down, the opposite happens. You're making more money on the loan, but your insurance policy loses money. So therefore, it typically works out, except when rates come down so fast, the insurance policy is way upside down, but you haven't closed the loan yet. So what happens is that insurance policy says, we're going to do what's called a margin call, meaning I know on paper you've got the profits there, but you haven't closed the loan yet, and I'm not going to wait, and I'm not going to risk it. I want my money, and I want it now. And lenders have to write a check for that, which is why you saw some lenders say, we don't take any more loans, we can't do any more locks. It's because of this margin call mechanism, Clayton, that very few people understand. This is why when rates have gone up, it actually alleviated this potential problem. So in a way, it was a blessing. And longer term, if we don't see too much that the government gets us in debt too quickly, we should see rates settle down.
And we have to recognize that margin call that exists isn't just because of business practices. There's also regulatory practices, and the regulators are watching ratios, which puts pressure on lenders to make that margin call and squeezes warehouse lines. And that's something that's kind of been impressive to me, to see a small group of leaders in the industry come together to get with regulators and hopefully loosen that up a little bit so we don't see this squeeze. And I think that one of the things that's really exciting, the one exciting thing going on right now is that the housing industry has the potential to be a real bright spot in this recession versus being the darkest spot in the last one. And the industry coming together to support putting capital back into the economy and helping homeowners refi that cash can go into other parts of the economy is something that I think this community, that the folks that are on this call have a big ability to impact.
Clayton, you are so right. And mark my words on this. I promise you that this will happen, and I'm highly confident in it. the first thing that will turn up is the housing market. It will take a bit of a hit right now because, as we talked about, it will slow things down. It won't be terrible, but the housing market was super healthy, more demand than supply. And it'll be harder for businesses to get re-ramped up and openings for large companies and restaurants to get restarted again. The first thing that will turn up is as this thing starts to calm down and go away, people will get back to buying houses, and that will lead us out of it. People will be doing more refinances. This is what's going to lead us out. And if you're doing somebody's refinance, or if you're thinking of doing a refinance, don't just look for a lower rate. Look to reduce your debts. Look to take a shorter term. This is a golden opportunity for you to build for your future. And like you said, this is a time for us as an industry to help the general public by accessing money that's in their home, to help them get through this by reducing their monthly payments. This is what we could do for to do good in the world right now.
Barry,
go ahead.
Yes, I don't know if this is a question that is even something that we would have any answers to this, but I kind of pose this to the entire panel. So today I spoke to 3 people, 1 major wholesaler, and 2 major retail guys, and all 3 of them said that they had in 1 week they did more business than they've done in some of their best months in terms of taking applications in. Are those loads going to be able to close? I mean, even with 90-day locks, it's an ugly situation out there between actually the physical appraisals that need to get done when a drive-by isn't called for. What do you guys say?
Yeah, I mean, Andrew,
Ryan, you're on the front lines.
That's a great question. That's a really good question. I think if you could take a poll, lenders would tell you there are hundreds of people short, when it comes to capacity to help close these loans, which is, why we're seeing, regardless of the MBS activity, rates aren't necessarily dropping because they just already have too much business. Almost everybody has in their pipeline right now more than they do in a quarter, to your point. And so we've got to get through that business right now. And if we have any sort of like self-quarantine for 30 days, that's going to throw another monkey wrench into this. We're really waiting for Fannie to come out with some direction on possible drive-by appraisals and how we handle VOEs. This is very, very fluid. Anybody that tells you they have the answer and it says they can close 100% of their portfolio, I'm sorry, I'm not sure that they're being truthful with you. So we're just doing our best.
Brian, I know there's 2 things out there right now that like we have 23 states that are approved for remote online notarization, and there's a bill in the White House right now, or in the House that would have a federal approval for all 50 states to have immediate access to remote online notarization, which would be one small part of that. Like clearly there's a big implementation timeline there. It doesn't happen immediately, but like the pressure is there. And I've also been, I think this is already out there in the public, but I know that the GSEs are working on Fannie to Freddie or GSE to GSE approval for appraisal waivers or light and load drive-by appraisals on refis, GSE to GSE, which hopefully loosens up some of that refi market.
I'm just excited about, I think that's going to be one of the many things that we learned through this is that online notary. I think lenders are scrambling to implement that, and I can't see us really going backwards once we have that efficiency in place. So it's one of the things that it's actually going to increase our efficiencies through this tough time.
Yeah, I know, Frank, I think you had a question. And then Megan, I know you've been monitoring what's going on there. So Frank, tell us, and then Megan, maybe you can monitor what people are asking.
Yeah, my whole thing was this, first of all, the slide was phenomenal. Thanks for getting it together, Barry. Appreciate it. And having Dr. Roizen on was fantastic. And obviously in the first part of the show here at the live, a lot of it was, it applied to everybody, if you're in the industry or not, right? And now we're spending a little bit of time definitely looking at the mortgage side of things and how things are going to be impacted mortgage-wise. We haven't really talked about the real estate agents yet. So I kind of want to touch base on that just a little bit here, because we're definitely seeing a lot of things happen in that world. We're seeing potential sellers go, I'm going to wait this one out a little bit, and also what we recently have been seeing is where, like, for example, my local board of realtors just sent a email out to everybody, like an urgent email saying, hey, absolutely no open houses, no broker tours whatsoever. that's going to take kind of a big toll on the real estate industry. I know we talked about this on our last live on Sunday, but I think for the realtors that are watching, they may want to hear a little bit from you again, just on what are your thoughts on all this? Because the Board of Realtors is actually saying, hey, use technology, use things like Listing Booster or Keyboom or whatever, where it's like they can preview properties without actually having to go into the property itself. But I just wonder if we could just talk a little bit about the realtor side of this thing, from your perspective.
Such a good point that you bring up. And if you're looking for a home or if you're looking to sell a home, there will be a slowdown, as all of these experts have told you. And you're right. And great tools like Keyboom and Listing Booster really help. The thing that we have to understand is that what are the fundamentals? Whenever you have a panic situation, if you put on your Warren Buffett hat or your Sir John Templeton hat, or you think about the great investors of all time, if you try and think like them, I know the most important thing here is the health situation. I get that. I'm 100% on board. But you're asking a question that's a business question. I would think that to some degree, there is going to be a very good opportunity here. And I think that if you are looking to purchase a home, if you think about where you were a month and a half ago, you were being outbid, you're having a tough time finding inventory. So now, to the extent that you can do this safely and use technology, and I understand that this is not a perfect world, but this may actually be an opportunity for you right now, because here's what's going to happen is, pray to God that it's quick, but at some point in time, this is going to level out. So you always want to look at, when there's a crisis, where were we before things got crazy? Before the world turned around, we had an environment where real estate values were going up, where there were more buyers than there were sellers, where the interest rates were very low, and where our economy was doing good. So while it may take some time, we will get back there, and you will see values rise. So this could be an opportunity to purchase a home. And if you're a homeowner, don't worry if there's a little bit of a dip here. It will come back.
You wonder what with new home construction. I mean, how much of that is going to get put on hold over the next couple of months? So the ability to increase our inventory. Hey, we're hearing a lot about EPOs increasing, early payoffs.
Yeah.
Lenders going out there and moving them from, 1 month to no months to 3 months to 12 months. And again, without naming companies, it's one of the big ones was a wholesaler who apparently missed a few margin calls. Again, I'm sure a lot of this stuff is happening out there. Is this connected? Is it going to hurt your retail over wholesale? Is there any different? Can you distinguish between the two?
So Brian, the first thing you said was brilliant as well. It's a great question that you talk about the EPOs, but you mentioned in passing a very, very important point. Now, I'm dear friends, as you know, with Ivy Zellman, and I talk to Ivy now almost every day about what's going on in housing, and she's the #1 housing analyst in the world, okay? So Zellman Research is the #1, the most respected housing analyst in the world. And she is telling me exactly what you said. So you nailed it. You are correct, because builders are definitely slowing down. So she looks at it from their profitability standpoint too. But yes, certainly that means less supply on the market in an already depleted environment that, in a strange way, bodes well for home values going forward. Now, to get back to your question, we always seem to be fighting the last war. So yes, early payoffs definitely are a concern. So when you take a look at an early payoff at, typically 6 months from now that you have to wait before, you can refinance that loan and pay it off, that's something that was causing lenders to lose money. But, when interest rates go up, that becomes less of a problem. What I think might happen is that as we look back at the last war and we say, okay, we were having a very tough time losing servicing, I think that those early payoff thresholds may increase to more closely approximate the time it takes to break even on servicing. I think so. Just one man's opinion.
So Linda brought up something, she said, do you think that we should make a weekly Facebook Live update during this crazy time? And for anyone that's watching, I think that this pandemic is giving us a great opportunity to step in and be an advisor in the way that we can be without actually touching people. And it's through the use of social media. So yes, I encourage you to get on, talk about the market, update your clients, give those testimonials, try and connect with people while we are in quarantine and we can't connect with them. And the same goes with real estate agents. Do you guys have anything that you want to say about, how we can engage and build those relationships when we can't be together.
And I got something to kind of piggyback on that, because I agree. Like, we should be out leading the way, loan officers, originators, CEOs. But, you know, Barry is kind of an educator of the educators. He's teaching the teachers. And I couldn't imagine doing my job without MBS Highway. True story. Barry, don't blush, but I wake up and I get the text from MBS Highway because you're on the East Coast, I'm on the West Coast, and I already know what's happening. The second thing I do after I wake up is I watch the update. And so just a little shout out, man. If you're an originator, I hope that you've had MBS Highway. If you haven't, I'm not sure how you've done your job lately. But I would tell realtors and the consumers watching, like, it is worth its weight in gold. Like, subscribe now, because I don't know if you're going to go out there and do what Megan just said, which is an amazing idea, you have to be educated first. And so I'm thankful, and I just regurgitate almost everything I hear from Barry. He's really the smart one, but I'm able to share that with the world. So just a shout out and kind of I'm begging and pleading the originators, realtors, and consumers to subscribe.
Well, Ryan, that's awfully kind of you. Before anybody subscribes, buy Mike's book first, because I think we all owe him a debt of thank you. And, you know, Ryan, what you do, what Frank and Brian do, what Clayton does, what Andrew does, Megan, the stuff you do, all of you on this panel, I am your biggest fans. And I am so grateful and appreciative, as I think everybody is, because I think what all of us are really trying to do is we're all trying to do good here, and we're all trying to help people and get the word out. And as Megan said, you know, those of you watching this, use social media to get that word out, to get that education out. It's up to you. And, you know, I know that we're coming within 15 minutes of the call. I would like to say this, and I just really want to say this from the heart, that this is an easy time, wherever you are, to be frustrated. This is an easy time for you to be worried and to be concerned. And that means maybe our tempers are a little bit more easily to get flared.
Yep.
Please, 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 please. This is the most important time to be compassionate and kind and understanding, and know that if you're listening to this as a customer, your mortgage lender's just trying to make it through this time, okay? Because we need the longevity of that industry. You know, your real estate agent has had so many issues and troubles, and if you're because of this virus, if you're a real estate agent, understand the mortgage company that's out there is doing everything that they possibly can to facilitate this in these crazy times. And if you are in the mortgage industry, please know that your company, the people that are working there, they're doing their best, and the leadership in your company, they are challenged right now. They are seeing things change rapidly. They're losing money on different ends, trying to make it up on one end. This is not the time to think that anybody's trying to do something wrong. This is the time to be loyal, to be kind, to be understanding. And once we get through this, we'll all be so much happier. So I just want to say that before we go forward. And I want to thank all you for taking your valuable time. Nobody gets compensated or paid for this. You guys are all top level, super busy people, and you're all here just to do good for others.
Well, me and Frank are breaking the law by being down here right now.
We're too close together. And right now, it's like, this is not good.
Hey, the only thing I want to say, I'll add here, I think this is going to change fundamentally how people communicate with each other. I think you're going to see a lot of more lenders and realtors start to use different means of communication that, you know, a lot of, especially our younger buyers and sellers are using. But here's the point I wanted to bring up just real quickly. When the doctor said that he believes bovine colostrum might be the solution, and Barry said, what, can you just like get it over the counter? And he goes, yeah. So when we went and looked it up earlier, they do not have it at your Walgreens or your GNCs, or excuse me, your Walgreens or the CVS, but you might be able to find it at Sprouts, the vitamin shops, and your GNCs. So if those are open and you want to get the bovine colostrum that the doctor was talking about, those would probably.
Someone in the comments said you could find it at the Tractor Supply store as well.
That's awesome.
There you go.
We're just going to be out there eating patties, cow patties.
Beef, it's what's for dinner.
Yeah. Megan, any other questions that we should try to answer from people that are watching and that want us to try and see if we can be of help to them?
Well, a lot of people kind of, you talked about a calm down in the market, but can you give kind of a time frame on that? I know you said we need to go back and look at, before we got into all this, what was happening in the market. But as far as, short term and longer term, clients that are 30 days out or whatever the case may be, when is this settling down going to be taking place?
So, you know, a lot depends on what Dr. Mike was saying. He gave a very aggressive timetable towards a return towards normalcy. So that's very encouraging. That's encouraging for two things. The number one is health, but number two, that means less federal aid. Less federal aid means less supply of treasuries, which means less impact on treasuries having to go up, which will sort of pull mortgage rates higher too. So treasuries would rise, mortgage rates would rise. So less aid means less supply, less impact. If you were to ask me for the next couple of weeks in this time of uncertainty, I think that we can expect elevated interest rates because of the fear of unemployment going up and the fear of the Fed getting the need for a lot more borrowing. The longer it lasts, the worse that it would be for rates. The sooner we get something that happens, then we could see much better longer term rates and a much better recovery for interest rates. I think that a 3-week time frame, to me, that sounds too aggressive. I think that for the next couple of months, we're going to have a little bit of choppiness and probably a sort of higher rate. This should be more of a feeling that rates would be a little bit on the rise as we go through this period. Hopefully not too much.
Great. And a question, you know, that I've been kind of hearing around is with these unemployment rates rising, you know, after this whole virus goes away and settles down, do you see those numbers coming back down relatively quickly, or do you see this kind of escalating us into a recession if we're not already in one? And past a recession, I've heard people talk about this becoming a global depression. What are your thoughts on that?
Well, definitely in a recession. We're definitely in a global recession. We're in it right now. We were headed there anyway. You know, my forecast in 2017, I said 2020 looks like a recession year, and I kept to that forecast. And I think we would have hit there anyway by the end of this year because everything, you know, we were on, Megan, you were on with Dr. Lacey Hunt. He is the #1 authority, in my opinion. He's one of my idols for understanding the economy. And he was telling us that he felt that all of the indicators he shared, world trade and everything else, pointed to a global recession. So yes, that would have happened. Yes, we're in it now because of coronavirus, but the recovery from it usually is you don't stay in it very, very long, maybe within a year, and then you see a very nice recovery over time out of it. I think that we follow that pattern, Megan. I think that you will see good times ahead. We just have to get through this period of time here. First, let's put the virus behind us. Then there'll be a period of, you know, slow down, restructuring, get back on our feet, and we'll probably do it in better ways because the reset that will happen will be more efficient and it'll be a way that we could see actually better times in the future.
Yeah.
So I'd like to leave. Sorry. Go.
Yeah. And one of the things I'm just going to say is like what we're going through right now is allowing for the lenders that are best prepared, that are fully digital, that are the most efficient, that had people working from home without actually any kind of hiccups. Those are lenders that are going to survive this, and that's just the new way of doing business. You know, if you look at 2008, we went from an industry that was focused on managing risk for the maximum profitability to an industry that's focused on customer experience. This is, I think, is going to be something that's going to force us into just being the most efficient way we could do this in the least amount of contacts.
And one of the things that I think, Megan, do you have any other questions there?
Yeah, I wanted to ask you about the stock market. I know that you've made some pretty crazy calls, and I wanted to ask you about it. What's your
Well, yeah, I
target?
did. When the S&P was at 3,200, after peaking at 3,400, I said that the stock market was going to go to 2,350. And I know everybody thought it was nuts, and I talked about it on Fox. I said if it closes below 3,019, we'd hit 2,350. Look out below. Yesterday, we hit 2,350 on the S&P, and a lot of people are asking me, what do you think? I am sorry to say, but I do think there's room for it to go lower. And if you want to know how much lower on the S&P, my next level is 1810 on the S&P. And that isn't very different than what we've seen in recessionary times. Megan, you talked about a recession. So how does it impact the stock market? It's quite feasible and quite common to see a 50% decline during a recession from the peak of the stock market. S&P at 3,400, half of that would be 1,700. Given the severity of what's going on, I think 1,810 is a reasonable target for the S&P. So listen, don't panic. It'll come back over time. If you have time, be patient, view it as a buying opportunity.
Yeah, and that's really what I want to leave us with. Is I know we've gone kind of over on this call, but I think it's important because we've talked a lot about a lot of scary things that are leading people to have more stress, more anxiety. Let's end on a positive note here and talk a little bit about, you know, where people should be investing right now to come out on top of all of this, and just give some optimistic hope on what people should be focusing on and what they should be doing during these times to stay ahead of this.
Well, I'm sure everyone's got some ideas here. So let's open it up to them. I will tell you mine after everybody kind of gets a chance to give their views.
After a couple days of working at home, investing in a house with a nice home office feels like a pretty good idea.
I'm going to stay in my lane and know my role and defer.
Use this as an opportunity to go get to know your kids.
Yeah.
I would just
Listen,
say,
I'm sorry.
we've been through some really tough times before, you know, and if you just buckle down and you just get through it, you know, and for those who get through it, you typically come out the other end looking pretty good.
And I'll come back to a little more serious recommendation. I mean, I think we're seeing the lenders and the real estate professionals who have invested in technology and heeded the advice of the industry that's been innovating and working on solutions that empower them to be more impactful remotely, digitally, mobily, are going to fare better during this period and on the back end of this period. I think it was mentioned earlier. This pressure on the economy, this pressure on our professions is, if there's going to be a positive impact, the impact's going to be we adopted the technology that people have been working on, and the industry has been pushing out there. And I think for better or for worse, there's going to be a bifurcation between the folks and the organizations who are ready digitally and ready with technology.
Yeah, you know,
Yeah.
I'm going to just dovetail off that. I agree with you. I think this is going to permanently transform, as I said before, how people communicate, and it's going to be for the better.
Yep.
You know, I always tell realtors and lenders when I do events, I say, you got to speak the language of those whose business you covet. And it's not French or English, it is technology. People are communicating in just such drastically different ways. It's changing right before our eyes. And I think this is really going to give a moment of pause for a lot of people in our industry to really start reaching out and looking at all the different forms of communication that we have. And I think that's going to be for the better.
And
Yeah,
Well,
so
listen-
sorry for all of you that were not comfortable doing video. Nah, you're going to have to get comfortable now.
And listen to what one of the things, you know, to kind of pile on to Clayton's point, you know, so two of the lenders I spoke to today they looked at, you know, technology not as something to add on to your business. And it wasn't the tool, it was part of your business. There was a core part of your business. Operations wasn't separated from technology. And those two lenders, they were calm. They, like, you know, you could hear in their voice a level of confidence. You know, whether they're going to be able to close all the loans that are in the pipeline is a whole other thing. But there's no question about it. They're confident in their system. Those that are embracing technology are going to win. This is a time we need leaders. You know, don't hide. Get your message out there. Take some of the things that were presented in this. Thank you, Barry, for bringing your personal doctor to share actually his wisdom on here. I mean, we're just blessed. I am actually, as soon as I get done with this, I'm going to go buy his book. I'm going to read about the chapter actually on what I should be eating. But I think this is the time to lead. This is the time to actually show that we're leaders in our organizations, our communities, and even in our families.
well, you know, thanks, Andrew. And all of you guys are such amazing leaders in this video communication, and certainly Megan. I mean, you are a great leader in our industry and helping people know that and understand that. So if you're watching this, you know, you're getting an eye into the future. So just be in touch with any of these wonderful people that you are seeing on this panel that are so generous, and they will definitely help you master your expertise there. You know, Frank, Brian, you guys have been doing that for such a long time and teaching people probably before anybody I know. And you guys have been great and great leaders there. And, you know, Megan, you asked a question of what you should be investing in. So I don't want to give anybody financial advice, but I would tell you what I'm looking at from a personal level. One, I think real estate is a great investment, and I believe there to be an opportunity right now in real estate. Of course, time will get you to, I think, incredibly profitable levels there. So I'm not saying to trade it. Don't buy a home and sell it 2 months from now. It's not what I'm suggesting. But this is a great time to buy a home, because over the next few years, however long it is, you will do extremely well. Stocks, to the extent you can afford to invest in the stock market, do so with some advice. And I will tell you what I would look at doing. I think that any level below 2,000 in the S&P, while it might still go lower, it's very hard to time the exact bottom. But I would say that if you were to invest at that level over time, for me, if I invested that level over time, I think that it will be a very good move for the long haul, in my humble opinion. But what I really want to tell you is this, is invest in yourself. Invest in yourself, because really just continue to be educated, continue to be pushing yourself to be the very best person that you can be right now in these times when you need it the most. And I know you've got issues. I know that you've got fears, but all your problems that you have, there's probably about 7 billion plus people out there who would beg to have your problems. And even more importantly, if you're worried about, is this loan going to close? I'm talking to my brothers and sisters that are in the mortgage business right now. If you're worried about, is the rate higher? Will I meet this deadline? But all of these things, will my customer be able to close because maybe they lost their job because of a VOA? I get that. I know that that's stressing you out. But there are a lot of people that would beg to have your work problems because they have no work right now. And just be thankful for that. Be grateful every day, and be grateful for these people that gave their time. And please say thank you to Dr. Mike Roizen for being such a prince. Buy his booklet, show him our appreciation. And this way, maybe he'd be kind enough to come back and do this for us again when we really need him to give us an update on this coronavirus.
Thank you so
and
much.
longevity. And
Yeah.
I
Oh, and
want
Mike,
to hear doctors think about longevity.
you know what?
Yeah.
Longevity, you will not believe what he will teach us on longevity. I've been listening to him for a long time. Listen, this is Oprah Winfrey. This guy's Oprah Winfrey's doctor, and many other celebrities out there and top level people. I don't know how I got so blessed and lucky that Dr. Mike took a liking to me as a friend and decided to help me as well. So he will teach us things that will be incredible for our lifetime.
Well, I just want to say thank you to everyone on here, and thank you to those that joined us here today. We will be going through the comments, so if you have any further questions, go ahead and post them there. And if you found this helpful, please share it out. Let's get this information out there, and I'll see you guys on the upside.
Thank you, everyone.
All right.